What is a full-time employee? And that is changing. Eligible employees are those employed on an average at least 30 hours per week per month. I know many of the groups that I work with, you've always had the ability to really pick what was an eligible full-time employee for benefits in your company. Many of you may have 40 hours, some 36, some 32. Now you're going to be looking at that you have to offer benefits to somebody who works 30 hours per week. Now the requirements for offering coverage. This is something new also. You'll meet the requirement to offer coverage to substantially all full-time employees if you offer coverage to 95% of full-time employees and dependents. 95%. That might seem kind of strange. I was talking to a gentleman in the meeting this morning who has a staffing agency. And he has a lot of employees that come in and out constantly on his payroll. And his worry is, what if I miss some of them? I don't offer insurance to some of them. Well, that's kind of what this is tailored to. He's allowed to at least meet 5% of them. If he misses 5% of them, he's going to be okay. I've had another group who has their eligible employees start at 32 hours. And they were concerned. We have a handful that work 30 to 32 hours. And I said, well, how many are there? Let's figure this out. And we were able to determine that they had around 3% of their full-time employees who work 30 to 40 hours a week that fell in that 30 to 32. So I said, I believe you'll be okay based on this because you're providing coverage for 97% of your full-time eligible. So that's kind of how this works. Interesting in this new proposal that dependents are defined as children up to age 26, but spouses are not included in the definition. So this is something new. Most of our groups do cover dependents, including spouses. I think I have one group that does not. But coming in 2014, now you'll have an option to think about. You might not want to cover spouses. If you're worried about, how that's going to impact your plan, you could drop spouses. And the idea being that a spouse now can go easily into an exchange and get individual insurance without a pre-existing condition. So there's no reason why spouses can't get insurance. Therefore, you don't have to cover them anymore under your employer-sponsored plan. That was interesting. The coverage has to be affordable and must provide minimal value. Whatever you're contributing to that employee's premium, as long as it's less than 9.5% of their W-2 wages for that year, then your coverage is affordable. So if you offer 3 plans, you're only interested really in that base plan that has the lowest premium, and you're only looking at the employee-only cost for that. That's how you're figuring your affordability. Now, minimal value. The IRS is going to come out with a calculator that's going to help employers determine minimal value of their plan. They have not come out with that. Basically, it's saying the actuarial value of a health plan is a measure of the percentage of health care costs on average that the plan is expected to incur. And HHS did a survey last year and determined that of all these employers out there, 98% of you already have plans that would meet this minimal value. And that's good news. And they said really what they were looking at is how much does your plan pay towards hospitals and emergency care? How much does it pay toward the physician? How much does it pay toward your prescriptions? How much does it pay toward lab and x-ray? And those are really the categories they were mostly looking at. And most everybody's plan, especially in that 50 plus, that large group segment, meets that minimal value. So that's what I've been told so far. They still have not come out with very clear guidelines in terms of what is minimal value. But if they stick to that and when they don't make us add too much to your plans for those who are large group employers, I think most of you will be okay and really need to be concentrating more on meeting the affordability of your plan.